had a family member who was incarcerated for not paying child support. And when he came out, he found out while he was in that he had high blood pressure and diabetes. So they gave him like a month's medication, but because he couldn't get a job, he couldn't get insurance, he never filled the prescriptions, never followed up with a provider. His blood pressure went through the roof, so the hospital admitted him. He's in the hospital now, and maybe for a week, they get everything under control. And then I go there to pick him up, and the nurse gives him about 10 prescriptions. And she says, you have to take this for your blood sugar, you have to take this for your blood pressure, and you have to get a glucometer so you can test your blood sugar. And then all of a sudden, she leaves. And I said, how are you gonna get all those filled? You don't have any money. And he says, I don't know. I said, you realize you're gonna be right back here if you don't do anything about your condition. So I go back outside and I share with the nurse. I said, you just gave him all these prescriptions. Did you ask him how he was gonna get these filled? If he had the ability to get these filled, if he understood what you were saying, how important this is? And she just looked at me. But I just felt like, wow, how many patients don't have someone advocating for themselves and won't speak up because they just think this is what you're supposed to do and no one's gonna help them. And unless we ask the individuals, tell me about what you're gonna do, what your needs are, if we don't have those conversations, most people are not going to offer it.